This is the graded skill demonstration for patient assessment, management, medical. Welcome to patient assessment, management, medical. I am Ms. Clow. I'm going to read to you the station instructions. I'll answer any of your questions, and then I'll give you time to gather and check your equipment. This station is designed to test your ability to perform a patient assessment of a patient with a chief complaint of a medical nature and voice treat all conditions discovered. You must conduct your assessment as you would in the field, including communicating with your patient. You may remove the patient's clothing down to shorts or swimsuit if you feel it is necessary. As you conduct your assessment, you should state everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how you would normally gain that information. You may assume that you have 2 EMTs working with you and that they are correctly carrying out the verbal treatment you indicate. You have 10 minutes to complete the skills station. Do you have any questions?
Can I go ahead and tell you the acronyms I'm going to use throughout the medical assessment so I can save time during the actual evaluation? Okay, I'm going to use an acronym DCAT-BTLS, which stands for deformities, contusions, abrasions, punctures, burns, tenderness, laceration, and swelling. I'm going to use the acronym TERD-P, tenderness, rigidity, distension, and pulsating masses. I'm going to use the acronym TIC, tenderness, instability, and crepitus, as well as PEARL, pupils are equally round and reactive to light. And I'm going to use the acronym AVPU, alert, verbal, painful, or unresponsive. May I check my equipment?
You may.
Okay, I'm satisfied with my equipment.
Okay, I'm going to read to you your unit call. Your unit is dispatched to the home of a 57-year-old male complaining of chest pain.
Okay, 57-year-old male complaining of chest pain.
Yes.
Okay. All right, I'm ready.
Begin.
Okay, BSI for my battles tonight. Okay, first thing I'm going to do is I'm going to go ahead and do a scene size up. Is the scene safe?
The scene is safe.
Okay, the mechanism of injury, nature of illness is chest pain. Okay, and the number of patients is 1. Okay, additional help. Yeah, I want to go ahead and get fire department here and get ALS on standby. And C-spine considerations. I'm only going to keep C-spine considerations if I do see any evidence of trauma. Okay, I'm going to go ahead and start my initial assessment. GLC ABCD. General impression. What's the general impression of my patient that I can't see right now?
You see a 60-year-old male laying supine in obvious distress. He has beads of sweat on his forehead.
Okay, 57-year-old male, supine, beads of sweat on the forehead. Okay, level of consciousness. Is the patient alert? Is he looking around?
He is looking at you. He is awake and alert.
Okay. Okay, GLC. Chief complaint or apparent life threats. Do I see any apparent life threats that I need to intervene?
You do not see any apparent life threats.
And his chief complaint is still chest pain. So.
He's complaining of chest pain.
Okay. All right, so GLC, ABC, airway. I'm going to go ahead and come up close to my patient, and I'm going to go ahead and assess the patient's airway. Is the airway patent?
Your airway is patent.
Okay, so, all right, breathing. I'm going to go ahead and look, listen, and feel, and I'm going to determine rate, rhythm, and quality of the breathing of my patient.
Rapid, regular, you have shallow chest rise.
Okay, shallow chest rise, rapid, and regular. Okay, do I see any injuries that would impair breathing?
No.
Okay, Ghost Medic, I want you to place this patient on 15 liters per minute, non-rebreather mask, high flow oxygen. Now I'm ready to go ahead and go into circulation. I'm going to look for any bleeding. Sir, have you had any bleeding?
No, he denies.
Okay, I'm going to go ahead and check pulse, rate, rhythm, quality.
Pulse is present, rapid, irregular.
Present, rapid, and irregular. Okay, skin color, temperature, and condition.
Cool and moist.
Cool and clammy. Okay, diaphoresis, possible shock your patient. Okay, at this time, I'm going to go ahead and make a transport decision. He's a load and go due to the fact that I think he's shocky right now and somewhat unstable. So I'm going to go ahead and go into my focus history and physical exam. First thing I'm going to do is take a sample history on my patient. Signs and symptoms, other than what I see with the diaphoresis and stuff. I'm going to go ahead and ask him, hey, how long ago did this start?
It started suddenly.
Started suddenly. Okay. Well, what makes this worse and what makes it better? The chest
Nothing.
pain. Nothing. Okay, what type of pain is it?
It feels like a vice around my chest.
Okay, a vice around your chest. Does this pain go anywhere?
It radiates to my left jaw.
Okay. On a scale of 1 to 10, 10 being the worst pain you ever felt in your life, what would you rate this pain?
At an 8.
At an 8, okay. Okay, and how long ago did this pain start?
About 30 minutes ago.
Did you do anything for this pain?
I took one of my nitro pills probably about 20 minutes ago.
One nitro pill about 20 minutes ago? Okay, so I'm going to finish my sample history. Allergies. Do you have any allergies to medications or foods?
I'm allergic to aspirin.
Aspirin. Okay. Medications. What kind of medications do you take? Is it just nitro?
Just nitro.
Okay. Pertinent past history. What kind of medical history do you have?
I had a heart attack about 2 years ago.
Okay. When was the last time you ate or drank anything?
I ate about 2 hours ago.
Okay. And what were you doing before this all started?
I was sitting in my recliner reading a magazine.
Okay. I just finished my sample history. Okay. Next thing I'm going to do is I'm going to do a focus exam. I'm going to go ahead and auscultate breath sounds.
Clear.
Apex, apex.
Clear.
Base.
Clear.
And base.
Clear.
Okay, so breath sounds are good. How about the heart? How my heart sounds?
Sounds normal.
Okay. All right, so perform focus exam here. Let's see here. Okay. At this time, I'm going to go ahead and we're going to take a baseline set of vitals on the patient. Okay, I'm going to note respirations. What are my respirations?
Respirations are 24, still shallow.
Okay, rate, rhythm, quality, 24 and shallow.
Yes.
Okay. Pulse, rate, rhythm, quality?
Pulse is 124, rapid and irregular.
124, rapid and irregular. Okay, I'm going to go ahead and take blood pressure on my patient. Okay, what's my blood pressure?
Blood pressure is 144 over 92.
Okay, 1.44 over 92. Okay, skin color, temperature, and condition?
He is still cool and clammy.
Okay, so I've got my baseline vitals. They don't contraindicate a possible assistance of another nitro. He's only taken one. At this time, intervention is called med control. I'm going to go ahead and call med control. Hey, med control, this is Soldier Medic 52. I have a 57-year-old male complaining of chest pain, has a history of cardiac problems. Patient is on nitroglycerin tablets, has taken one nitro. Patient's vital signs are respiration is 24, pulse 124, blood pressure is going to be 144 over 92. I would like to go ahead and assist this patient at this time in him taking another nitroglycerin tablet, sublingual.
Assist your patient with the nitro.
Okay. Patient takes it. Okay. Now I'm ready to go ahead and make a transport reevaluation. We are now loading the patient up on the gurney and we are now en route. I'm going to go ahead and perform a detailed physical exam en route. Okay.
You consider it, but you don't need to do it.
Okay, and next thing I want to do is I'm going to go ahead and perform the ongoing assessment. I'm going to reassess my initial assessment. Has anything changed?
No.
Okay. I'm going to take another set of vital signs and compare them with my baseline. What is my new set of vital signs? Okay, well, how about pulse? Give me a pulse.
Pulse is now 98.
98. Respirations?
Respirations are 24.
Okay, I'm going to take another blood pressure.
Blood pressure is 134 over 86.
Okay, now I'm going to perform another focus exam. Listen to breath sounds again, listen to the heart, and check my interventions. I'm done.
Finished?
I'm finished.
Okay, go ahead and clean up the station and return to your class.